live talk. Welcome, dear Rajeshwari. I am very thankful to have you here today so that we can hear more about homeopathy in intensive unit care. May I ask you to introduce yourself a bit and then we jump middle into things.
First of all, hello all viewers. Good morning, good afternoon, good night, wherever you are. And thank you, Marianne, for inviting me for this discussion on this very beautiful topic. It's very close to my heart, how homeopathy can be used in ICU, how it can be useful. So I'm Dr. Rajeshwari Rapata. We had been in the previous sessions also. I'm a former dean and a professor and a homeopathic consultant. I've been practicing since last 24 years. Homeopathy, and I also have experience as a hospital administrator where I have seen all the processes and all the things which happen in the hospitals, as well as managed it very well. And also I was a NEBH coordinator, which is a registration, government registration that is done for various legalities. Here today we are going to discuss about how homeopathy is useful in ICU, and I'll be giving more insights regarding this. Yes, over to you.
Yes, and I'm very thankful that you're giving more insights. So tell us a bit more about this thing, which is so close to your heart.
Yeah, to start with, how this came into my mind is of a incident which happened in my life, which I had already discussed, and I don't want to discuss it again. So this incident started making me think over it, that how homeopathy will be useful and how it can be utilized in hospitals. For that purpose, I started this course, that is the first aid emergency medical conditions, awareness of the emergency medical conditions, first aid, and how the role of the homeopathy in it. So how it can be used. I started a course on it to make people aware of all these conditions so that they can learn more about emergency medical conditions. The awareness is so lost. When the revolution first started about first aid, we all know the Florence Nightingale had started it during the World War. But here now, it is also very essential that people have to again regain the knowledge about first aid and use of homeopathic medicines especially. This corona had given a great lesson to all of us. You know, many people have lost lives. Many people have seen how medical system has failed in many conditions. So this course includes the awareness of medical emergency conditions, how one can identify the preliminary symptoms of a heart attack or the cardiac arrest. You can see the stroke. In case of drowning, okay, what can be done? In case of choking, what can be done? So multiple things can be learned, will be taught to people. They will be trained regarding all these conditions and symptoms. Further, there will be a way to learn about the basic life support skills, how to give the CPR, cardiopulmonary resuscitation, and further application of the homeopathic medicines in such conditions. Now, many people are skeptical about the role of homeopathy in such conditions because even in the organon, we know that aphorism 61 to 70, Dr. Hahnemann had specifically mentioned about how vital force is deranged, and in that condition, how homeopathic medicines may work and may not work. So I especially pay more stress on this because, you know, he has, when you read it carefully, you'll come to know that he has also mentioned about the primary action and the secondary action of medicines. So when the patient is in such a condition where he is unable to respond to any homeopathic medicine, of course, we have the adjunct treatment, that is the invasive methods, the interventions which are provided in the hospitals. Okay, intubation is done, tracheostomy is done, okay, and the patient is put on the ventilator. All these things are done. Many antibiotics, many drugs are injected into the patient to revive him from the condition in an emergency case. But even though all those are done, homeopathic medicines will work. How?
Definitely.
After giving all those things, you'll see that there is a primary action which is done, which happens because of those drugs which are induced into the patient. The patient revives a little bit. Okay, it may take some time, but to add to it action, when the homeopathic medicines are given, it will act as first giving the opposition to the primary action, which happens because of the drugs. Okay, because the person has already revived to a certain extent, then the primary action of our homeopathic medicine starts. So in this way, it will help. And I feel that there is a need of a lot of research in this emergency medicine, where homeopathic medicines can be given to the people in ICU. We are not given the scope to use homeopathic medicines in the hospitals, and how can we know? So it is my appeal to the government, to the authorities, that homeopathic medicines be used in the ICU so that people can come to know its use.
And its efficiency.
Yeah. And pharmaceutical companies especially, they need to help in promoting the research in this. Funding is also very important. Also encouraging the homeopathic doctors to work along with the people or doctors in the ICU so that they can collaboratively do research, they can collaboratively help the people and get more advantage of homeopathy. So this is one thing I feel is very important in ICU. Now, one more thing I want to know. We all know that there are certain homeopathic medicines which are called as homeopathic trocar, okay, homeopathic catheter, isn't it?
Homeopathic knife.
Apocynon is called as the trocar, homeopathic trocar. You know that, yes, because the fluids retention will help in removing the impurity, peritonitis. It helps. And then we have the homeopathic catheters. Sabal cerulata is there. Solidago verga is there. So many medicines which can help as homeopathic catheters, which will help relieve the bladder retention, urine retention in bladder. So how it is very useful. Now, as I work as a NABH coordinator in hospitals also, I've seen people, the catheter is used in the patients who are bedridden. They are on the ventilators, they are on the intubation. While they are on all these things, they have secondary implications of all these interventions. Okay, VIP is more common in hospitals, in ICU, ventilator-associated pneumonia. So ventilator-associated pneumonia can be prevented by giving homeopathic medicines aside, by giving it along with the whatever interventions, as an adjuvant therapy. It can be given in the lower potencies, and that will help. I myself have seen when a patient was admitted in the hospital and the homeopathic medicines were given, and all the parameters were suddenly becoming normal because of the homeopathic medicines. It can also help the patients to delay the complications which can happen in the further treatments. One more thing is about the hospital-induced secondary infections.
Yeah.
So we all know that homeopathic medicines are good for immunity. They can act as immunity boosters. When immunity boosters can be given in the homeopathic form, it will help in reducing the infections, isn't it? It will also help in preventing those secondary infections.
Definitely. So, when you're talking about low potencies, which potencies do you think of?
It depends on the medicines which are using. Certain medicines are more useful in 6 potency, certain medicines are in 12 potency, 30 potency. So till 30 potency, I feel it's more useful in emergency medicine, in ICU especially.
Okay. I just wanted to make this clear for our listeners.
Yeah. Because the vital force needs that much potency only. Higher potency again, we can, there's a chance of aggravation. So it's not preferred, higher potencies.
Yeah. So just to give an example, when you're talking about helping a client that is on the ventilator and probably has a lot of medication already going on and suffers from pneumonia, what kind of medications are you thinking of in homeopathy?
So now again, things are like when we see a patient on the ICU bed, unable to talk, sign language, sometimes totally on sedatives. It's very difficult to take a case as we take in the homeopathy, isn't it? Mental symptoms, okay, the total history of the patient and all. At that time, only patient history from the relatives is useful. So that is the maximum use which we can make to find the simillimum. Okay, and of course, simillimum is the first choice. Second choice is specifics.
Okay.
The constitution and then the related disease specific. So in this way, one can go towards the case taking and select the remedy. So I think that there are certain specifics which can also be used as well as simillimum.
Give me an example.
Yeah.
Can you think of an example, just one client, how you did it? Because for me, it seems to be quite difficult, you know, somebody unable to talk, not showing much signs. All we have is the diagnosis and what we see.
Of course, that is why I say the collaboration is needed, integration is needed. It's not only the responsibility of the homeopathic doctor. People from all the fields, they stay there. The anesthetist is there. The surgeon is there. The MD doctor medicine is there. Okay, everybody collaborates and then makes the decision. Okay, so that is what I feel, that research is more needed, and homeopaths should be included in the ICU to do the research there. You know, clinical trials should be also encouraged in hospitals with homeopathic medicines. So here the role of the authorities, the government, and the pharmaceutical industry, homeopathic pharmaceutical industry, plays a great role.
Yeah. I think this is underestimated when we think about pharmacy and medications. Most people think about, yes, antibiotics, cortisone, and so on. But the huge range of homeopathic remedies that we have and the effectiveness is not known really, or not known anymore, at least in Western Europe. It's different in India, of course, where you can study homeopathy. But in the Western world, the knowledge is just fading away.
It's really great that our government has started the Ayush ministry, and really we are all thankful for that. You know, and we see that we have thousands of homeopathic medical colleges and hospitals in India. Yeah. Okay, and within few years, you will see that lakhs and lakhs of homeopathic students will be passed out, and they will become the homeopathic doctors, postgraduates, homeopath doctors, all these people who will be practicing homeopathy. They will have so much of passion in giving homeopathy to patients, treating the cases and all. But what will happen when these doctors they go and get into the hospital in their old age, or if in case of any emergency, suppose, will they get the homeopathic medicines when they get admitted to the hospitals? That is one question which I ask, because they are passionate towards homeopathy and they would like to have homeopathic medicines when they are admitted in the hospital, isn't it?
Definitely.
So what will these lakhs and lakhs homeopathic doctors do when they get admitted to a hospital in an emergency case? Will the hospitals allow another homeopath to treat him or
Yes,
her?
especially in the Western world, we need to say, will it be allowed? And when I think of the mother of a friend of mine dying in an Austrian hospital, and we so desperately wanted to help her with homeopathy, and the colleagues in the ICU just did not accept and did not allow.
Yeah. So this is one condition which I feel has to be studied more and looked upon, and some solution should be found out for that. Another thing is the right to choice of medicine.
Yeah.
Now, already lakhs of doctors have passed out. They are treating patients with homeopathy. Many people are really depending on homeopathic medicines. They want the homeopathic medicines. So when they get admitted to the hospitals, these patients, when they require homeopathic treatment, as an adjuvant, suppose, along with the other interventions which are being given to them, okay, but they want homeopathic medicine alongside with them. So then how will those patients get the medicines?
Yeah.
Does every hospital have that homeopathic facility? Just like they have the physiotherapist, they have the dietitian, the nutritionist, they have all the other
great.
diagnostic departments, they have the counselor, they have the psychiatrist, but why not a homeopathic doctor in every hospital, either private or government? Why it is not mandatory? It should be.
It should be, yes.
Because it's the right to choice of medicine of the patient. The patient needs it. Where will the patient go? So this is one more question which comes into my mind. And of course, these things have to be looked upon. Some solutions should be found out for these, and some regulation should be made for these things. Some new policy should be adopted where everyone gets their choice of medicine, because belief is one thing which is very important in medicine. The patient, when he has the belief, then many of his symptoms get cured, isn't it?
Yes.
Either it may be homeopathy, it may be Ayurveda, it may be anything. The patient who takes the medicine, his belief system works much more. It can be, you can call it as a placebo effect or whatever, but it benefits the patient. That's what is more important.
This one is very, very important. And I went a bit astray because I remembered my last time in a hospital. Oh my God. If I wouldn't have had my homeopathic remedies with me, and if I wouldn't have had the advice of my homeopath, I thought I might not have left this hospital alive.
Yeah.
I had the notion I get worse day by day with all what they gave to me. And if you're not used to that, if you're used to have homeopathic remedies your life, and then suddenly you get high dose antibiotics and high dose painkillers, it's toxic.
Yeah.
It's toxic.
It's toxic. So that is why, to counteract those toxicity of those drugs, there is no choice for the other systems apart from giving those drugs. But as a homeopath, we can help them to counter those toxic symptoms arising from those life-saving drugs, isn't it? So
yeah.
That can be worked together. And for that, a chance has to be given.
And I really like the idea of a homeopath being mandatory in any hospital.
Yeah, that's what we do. Yeah.
And I'm just thinking about this crazy development in Germany at the moment, where we have politicians that want to forbid homeopathy.
Okay.
It's crazy. I sometimes think if Samuel Hahnemann would know about that, he would turn in the grave. It's very crazy.
When we talk about Hahnemann had done a lot of experiments, lot of exploration. And when we talk about Hahnemann, we have to also think as Hahnemann, as we are Hahnemann. We have to be in his shoes and understand what situation he was in. And it is no longer the same situation now. We should be ready to explore. We should be ready to research. We have to write a new edition based on those same principles, but new results and conclusions of those experiments which are conducted by us. That's what I strongly feel.
I don't think that the situation actually is so much different. When he invented homeopathy, we had this thing with cholera going on.
Yeah.
And the normal allopathic treatment was more or less killing the people. Just as it is today with a lot of things, where I think in 200 years, we will say, oh my God, how could they do that?
Yeah.
Yeah. And so he wanted to invent something that really worked and that we don't want to skip after 200 years. And I think with homeopathy, he made it, because now 220 years after, we still are doing what he did, maybe a bit more refined, maybe a bit more elaborated, and the same will be for in 200 years, but we won't look back upon it as medieval.
So from this, we can derive that what a super science it was at that time, when even the medicine, modern medicine, was not evolved. So whatever was practiced 200 years back, those medicines which were crude during that time, we are still using it in the similar way with little bit of advancements, and they're still working wonders.
Yeah.
So if we do it more refined and more remedies being found, proved, and a lot of research being implemented into the hospital as well, then you can see that how the mortality rate will decrease in hospitals. The prolonged stay in the hospital, the patient who is admitted and who can be relieved from the hospital, discharged from the hospital within few days. Okay, but because of certain interventions, because of certain drug toxicities or different other conditions, the person prolongs a stay. He may go to 15 days or 1 month. So this prolonged stay can also be reduced when we give homeopathic medicines to counteract that toxicity of those drugs or whatever interventions which are done during a stay in the ICU.
And not only that, if after being gone from the hospital, the patient goes on taking homeopathy, it will get stronger and stronger and stronger.
Yeah.
Whereas the allopathic remedies, we will sooner or later stop and the patient will be on its own again, or on his own again. While with homeopathy, we can go on treating and establish much more health than we could do without.
Yeah. Yeah. I will tell you an example of a person who had come to me with a high BP, and and he was so much anxious and all, and he was having BP since high blood pressure since 5-6 months, but he was negligent about it. And suddenly one day he came to me with a headache and all that, feeling uneasiness in the chest and all that. And I checked for his blood pressure, and I found that his blood pressure was high. And then I asked him to sit calm for some time, and again to verify. Second time I checked, and again it was same. So I gave him a few drops of spartium scoparum. So spartium scoparum, after giving that, within 10 minutes, his blood pressure fell down. So it decreased. And that's how homeopathic medicines work. Within 15 minutes. And then I gave him some homeopathic medicines along with spartium scoparium in low potency. First, I gave him mother tincture and then lower potency. And then after 1 month, he saw that his blood pressure has stabilized, normal, and is okay. So he's continuing the medicines. So this is how homeopathy works. It doesn't mean that in certain conditions we can't give homeopathic medicines. Not so. Another case I would say arnica helped so much. The person had an accident, it was a head injury, and then the person had come, the relatives also were flocking together, and then there was no chance to do anything. And suddenly I checked the BP, it was shooting up, and then I gave arnica 1M, and I saw that the BP has gone down. And then he was taken to the hospital. So it works. You have to try, you have to give homeopathic medicines. And that is why I ask that a chance be given to the homeopathic doctors to be in the ICU and give homeopathic medicines, do the research, and properly documented cases have to be maintained further, and they have to be encouraged by the pharmaceutical industry as well as the medical authorities and the government as well. So this has to be done.
Yes, and one thing that is very important, which you told, is that homeopathy acts within the minute. It is not slow in action as some people think. It acts within the minute. The patient is relieved within 5 or 10 minutes. And this is something you usually cannot achieve with allopathic remedies. Not in that speed.
I recollect another case where there was an old lady, and she was taking treatment for cervical spondylitis. Okay. And this lady has a specific symptom, It was rainy season, and she used to sleep near the window and on the bed. And she used to get thrown off from the bed around 2 to 3 meters away. From the bed, she used to just throw off. She used to get thrown off, and then she used to fall down, and then she used to realize that somebody has pushed her from the bed. And then she asked her son and people at home to go and check near the window whether there was some electric current or something. Some live wire may be there, she thought like that. And then she asked everybody to check for it. There was nothing as such. And then the symptoms revealed that she was getting electric-like shocks. And because of that, she used to get thrown off from the bed and she used to fall down. And she really had that sensation. Now, this is all the nervous system, the derangement of the nervous system because of the cervical spondylitis she was already having and all that, nerve symptoms. Now, homeopathic medicine, rhododendron helped here. Lower potency, I had given rhododendron, and within 2 days, she got relieved of all the symptoms. She was okay. She was walking well. The dizziness disappeared. Her electric shocks like symptoms, those disappeared. She was not falling from the bed. So what will you say about this?
The so-called homeopathic miracle.
Yeah. So in this way, homeopathy works, and people, these are the specific symptoms which we catch. There is the symptoms, stormy weather and electric-like shocks in rhododendron, if you find.
Yeah. So when we think of homeopathic doctors working in ICU, we we really have to have somebody who is very well trained in observation and materia medica and knows a wide range of remedies by heart.
Yeah. So that is very important, knowledge of materia medica and how to apply those medicines, the peculiar symptoms, and what potency it can be given. That also is very important.
Mm-hmm. Yeah, it looks like that there's a bit of specification that we need to have. Thinking of India, is in India already a training going on for homeopaths who want to work in ICU?
I'm not aware of that.
No. But you yourself developed a course for those who are interested.
Okay.
So tell us a bit about your course, your training.
My training is about the first aid, giving homeopathic medicines and first aid. So before identifying what is first aid, we have to also know what is the medical emergency condition, how to identify those, So I primarily focus on making people aware about the emergency medical conditions and then giving the first aid. Further, about the homeopathic medicines, giving them knowledge about 30 homeopathic medicines, which are basically important in relieving the person at the first instant till the advanced medical care arrives or the person goes to the hospital. Till then, one can use these homeopathic medicines. So, you know the Staphylococcus aureus. The Staphylococcus aureus is a very excellent medicine, which can be given in the early stage of UTI. So that, so many antibiotics which are given in urinary tract infections, norfloxacin and then O2, ofloxacin, and so many medicines, antibiotics are given, and then they have their own side effects. We all know that very well.
Yeah.
So, Staphylococcus aureus, if you give in early stage, the symptoms of the UTI immediately are reflected as the burning urination and all that. Now, Staphylococcus aureus has its own peculiar symptoms. Suppression is one of the cause. If you have that symptom, as a homeopathic doctor, you can understand that. And Staphylococcus aureus can be given. Apis mellifica can be given, especially there is some kind of edema over the face and legs.
Yeah.
Apis mel can be given. Cantharis again has its specific symptoms. So these few symptoms, if you know it and you give the medicine, it can stop the UTI then and there. I have given medicines to the patients where they come with symptoms in the morning and the evening, the symptoms disappear with few doses of the homeopathic medicines.
What a relief.
Isn't it a real relief, isn't it?
Yeah.
So that's how medicines can be given. Now coming to my course, this is a course of 5 days, totally 9 hours. And then after the first day, the persons will be taught about the awareness of the emergency medical conditions, the environmental conditions which produce the emergency conditions. Then you have the drowning, you have the heart attack, and the brain stroke, and then the burns. So in this way, several other conditions are made aware to the people. Then you are taught about the first aid, how to provide the first aid in these conditions. After that, the role of homeopathy. The 30 important medicines are taught. Even after that, the PDF will be provided to them regarding all these important notes regarding these homeopathic medicines. If required, on request, homeopathic kit will also be provided. So this is about the course. Apart from that, a pediatric first aid course also is on the way, which is very important for the school teachers to know, because in schools, small children who come to the school, they may have acute abdomen pain. Suddenly they are crying with pain, and what to do, the teacher doesn't know. At that time, we can give the homeopathic medicines, which are very safe. Little bit of injury, the teacher can apply the calendula lotion, and we all know calendula is a broad spectrum antibiotic of homeopathy. Even many of the doctors, the modern system doctors, are using calendula. In surgeries, calendula can be used to prevent the secondary infections. It also helps in healing by first intention.
Definitely.
So it's such an excellent medicine, calendula. So it can be given in the tincture form, in the lotion form, in the potency form, internally, as well as externally it can be applied. So in this way, we have numerous medicines which work excellently.
You only have to know how to apply.
Yeah,
and
so
you have to have them at hand.
That is what is the course about, how to apply these medicines in different conditions.
So if people are interested in doing this course, do you do it online or offline?
Yeah, I do it online as well as offline. Basically, I was an MUHS coordinator in working with a healthcare consultancy where I used to go to the hospitals, teach people about the staff about the hospital infection control. And after doing all that, I found that why not apply homeopathic medicines in such conditions which can reduce the ventilator associated pneumonia, the catheter induced infections, and many other conditions, which will help the hospitals for a better outcome to
and save money.
Decrease the mortality rate as well. So I provide these courses for each and everyone, as well as the healthcare staff, the medical students, the lay people, general public, the gym trainers, the exercise, the people who are enthusiasts of exercises, yoga trainers. So every person, every human being can get the help from this course.
Yes, I posted your website in the chat and I posted your Calendly link if somebody wants to have an appointment and talk with you.
Yeah.
But we only can recommend people to connect to you, maybe do a course and get access to that excellent knowledge and to be able to use homeopathy in emergencies.
Yeah. So they get the knowledge about the emergencies, different emergencies, and how to use the homeopathic medicines there.
Yeah.
I do the WhatsApp classes. First, I have a WhatsApp community. I have a Facebook community as well, where people can just log in and then they can ask any queries if they have. I do group classes also online. Yeah. And my basic anatomy course is also there. I wanted to tell in addition. A basic human anatomy course for medical students as well as advanced human anatomy course for the medical students, lay people or people exercise enthusiasts, the palate trainers, the yoga trainers, all those who are very enthusiastic about their body and fitness, they can join for the basic human anatomy course as well.
Which always is useful.
Yeah.
The more you know about the body, the better you are in helping. Anatomy is it's a really important basic.
It's a basic. As I've been a professor since last 23 years in human anatomy, so I thought it is very important for everyone to know about their body and how it functions and how to keep it fit.
Definitely. Definitely. Rajeshwari, thank you very much for telling us all about your ideas around emergency ICU care and homeopathy. Is there any recommendation you want to give for people who are interested in learning about it?
Yeah, recommendation is join this course, learn about your body, learn about different emergency medical conditions, and know about how homeopathy can help in those conditions. You can keep a first aid kit at your place and use the safe homeopathic medicines for your children, for yourself, for your relatives and friends. You can carry it when you can go for a trekking or an adventure trip. It helps. I myself am using homeopathic medicines wherever I go, and it works, you know, you will experience it yourself. So avail this benefit, learn, and be healthy.
Yes, yes. Be healthy and have a lot of fun in
Yeah.
using homeopathy and get inspired. Rajeshwari, thank you very much for this live talk. I really enjoyed it. And I hope that you inspire many, many people to learn about
Thank
it.
you.
And I
Thank you.
really love your idea that we have a mandatory homeopath in each hospital. That would be
That's what we are
really a
looking
dream
forward
of
for.
mine.
Yeah, that's what we are looking forward for. It's every homeopath dream that in case a homeopath gets admitted to a hospital, he gets one of his colleague also to treat him, isn't it?
Yeah, 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 yeah,
So it
yeah.
will be so wonderful. Yeah.
Yeah, and one
Thank you so
would,
much, Mary Annie, to provide this platform for telling people, to make people aware about my courses and about the role of homeopathy. And thank you. You're doing a wonderful, great job promoting homeopathy and sponsoring for it. Thank you so much.
I
Grateful.
thank you.
Grateful.
Bye. And thanks everybody for listening.